Hi, my name is Sarah. I'm gonna be doing my central line dressing change video. So before I go into the room, I'm gonna want to make sure that I have some of my supplies ready. Excuse me. I'm gonna have a central line dressing kit change, or at least all my supplies that I need for that. I want a measuring tape, a swab cap, a biofilm if that's needs to be changed per agency policy, 2 masks, one for me, one for the patient, and some hand sanitizer and gloves. So I'm gonna go in. Hi there, Bob. I'm gonna provide for privacy. My name is Sarah. I'm gonna be your student nurse today. So I'm here to do a central line dressing change. I looked in your chart and you have an order for that. Do you have any questions about that?
Nope.
Okay, perfect. Do you want to go ahead and just verify your name and date of birth for me, please?
Bob Owens, 5/18/1965.
Okay, and that matches his band. So, Bob, you do have that order, like I said, for the dressing change. We're gonna go ahead and get that all switched out. Do you have any allergies?
Nope.
Okay, so while I do your dressing change, are you able to keep your face turned away from me and put on a mask?
Yes.
Okay, so I'll give you a mask. I'll put a mask on myself, and we're gonna want to just maintain a sterile environment. I want to make sure that Bob is able to follow commands. If Bob was confused, or if this was a child, I would have a parent come in and sit with the child, try to distract the child while we do this. If it's like an elderly confused patient, then I would have just another nurse on standby just to kind of help. So now I'm gonna go ahead and put my mask on. All right, Bob, I'm gonna give you your mask, okay?
Okay.
Sanitize one more time. I'm gonna go ahead and just get my stuff ready. Okay, I'm gonna put some gloves on. I do have a waistband right down here. So Bob, in just a second, I'm gonna just measure your arm. I'm gonna inspect it. I just need you to kind of look away while I'm doing this. Okay, so I have my tape measure. I'm going and I'm inspecting the site. I'm using Rita. I don't want any edema, any ecchymosis, any redness. I'm just gonna make sure that it's not super tender, and as long as it looks okay, I'm gonna go ahead and use our measuring tape. So what I'm gonna first do is I'm going to measure from insertion site down to here and make sure that there's no deviations. Anything greater than an inch, then that would, anything that is deviated farther from an inch or more would mean that the line is not in the proper place anymore, is what I'm trying to say. So as long as that measurement matches what is documented, then we're good there. And then I'm gonna go about 6 inches above the insertion site, and I'm just gonna go ahead and do a arm circumference. I want to make sure that this number isn't bigger than what's documented. So, okay, then I'll match what is in our chart. All right, and now Bob, I'm gonna have you keep your face away. I'm gonna go ahead and just start removing this. And while I'm doing this, I want to make sure that I am pulling towards the entrance of the pick line, and that's just because I don't want to risk pulling this out at all. So bear with me while I get some of this tape removed. And while I'm doing this, I want to make sure that I examine the dressing for any discharge or drainage or anything like that. Okay, now that that is done, I'm going to dispose of my dressing, remove my gloves, and I'm going to sanitize. Okay, So this would be in the garbage. I have my dressing. I do make sure that I have like a swab cap and a bio patch that's impregnated with CHG. I have these because depending on agency policy, they may have them changed at the time of the dressing change. So I'm gonna go ahead and open this. I'm gonna grab my gloves. Okay, so now I have my sterile field. I'm gonna grab my tweezers. And I can also lay out this. Okay, I have my tweezers and my alcohol wipe. So I'm going to pick this up and I'm going to clean around in a circular motion on the outside. Once that's done, I'm going to dispose of this in the garbage. So next, I'm going to take my CHG cleaner. So I'm going to go ahead and pick this up, and I'm going to do a scrubbing motion, almost like a hashtag, within 2 inches around the insertion site. And I'm going to allow for that to completely dry. This is going in the garbage. And then once that completely dries, I'm going to go ahead and use a skin prep. This is important, so just make sure that the dressing covers the PICC line completely and it preps the skin for the tape. You want to make sure that on elderly patients that with their skin being thinner, we want to maintain skin integrity while we're doing this. So go ahead and just apply this all over, and then once that is done, I'm going to go ahead and apply my Tegaderm over this dressing. There is a sticker on here that I'm going to put on, and I'm going to date and time this. Alright, and once I date and time that, I'm going to go ahead and get everything cleaned up. So I'm going to make sure that Bob is comfortable. I'm going to clean up all of my mess, remove my gloves, sanitize. This is all in the garbage. I'm going to make sure that Bob tolerated that well. Take this off. Take my mask, that goes in the garbage. And then Bob's just going to remove his mask and toss it in the garbage himself. So we'll get rid of that. And then I'm going to make sure that Bob has his colate in reach. He's got his side rails up. He's got his side table, his bed's lower to the ground, there's no obstructions. And then I'm going to leave and I'm going to sanitize as I leave.